Hello everyone and welcome back to our channel GDC Classes English. Today we are going to discuss the super model paper number 3, especially designed for Telangana Pharmacist student. With me you are going to study pharmacology, HAP and your biochemistry. So let's start the session without wasting any time. First question is your from pharmacology subject. We are going to handle 16 important questions. So let's get on to our first question. Question is, anti-dopaminergic drug used as antiemetic is. Okay, first of all you need to understand what is antiemetic. Antiemetic is drug that is responsible to inhibit the vomiting. Clear? From name you can understand anti and emetic, which will inhibit your vomiting. Next is anti-dopaminergic drug. It acts on your central nervous system, that is the trigger zone, because the brain, the CTZ is responsible to control your emetic process. Now, this anti-dopaminergic drug will act at your D2 receptor. D2 receptor, that is, it will close the central nervous system response. So, your GIT movement will also decrease. That's why this anti-dopaminergic drug is responsible for your antiemetic action also. Clear? So, what will be the answer? All of these, because all these drugs are antiemetic as well as anti-dopaminergic drugs. Clear? This is the answer. And prokinetic drugs means all these comes under your prokinetic category. The prokinetic means the movement of your GIT, that is your peristaltic movement. The peristaltic movement is responsible for the flow of your food. Clear? So, as you will inhibit these prokinetic movement, the GIT will automatically not respond for the emesis. Clear? Okay. Let's move on to the next question. Antibiotics inhibiting the bacterial cell wall synthesis are. Okay. As you know, the antibiotic drugs, there are many types of drugs. Macrolides, tetracycline, then there is your aminoglycosides and other is beta-lactam antibiotics. Beta-lactam antibiotics act, the mechanism of action of beta-lactam is that it inhibits the bacterial cell wall synthesis. And next you have tetracycline, aminoglycosides and macrolides. These three drugs works on the principle of protein synthesis inhibitor. It works on the principle of protein synthesis inhibitor. Clear? So, what will be the correct answer? The beta-lactam antibiotics. Clear? Okay. Now, this is the answer. Okay. Let's move on to the another question. You can take the screenshot of this chart as it is very much important. Okay. Now, let's move on to the another question, that is, which drug used as an oral anticoagulant? First thing, anticoagulant. Anti means the opposite, coagulate means which coagulates your blood, means the drug which is used for or which is used as the opposite action for your coagulation, that is also given by a oral route. So, what will be the drug? The heparin is an anticoagulant drug, you know very well, but it is given by a parenteral route. This dalteparin is also given via parenteral route. Decumerol is given by oral route. Enoxaparin is given by parenteral route. The correct answer will be decumerol. Clear? Also, they works on the mechanism by directly or indirectly inhibiting your thrombin synthesis. Clear? So, this will be your correct answer. This is the chart which is also very important. See, from here you can understand the parenteral anticoagulant are further classified into two types. One is indirect thrombin inhibitor, that it will inhibit the thrombin but that is indirectly. Second is direct thrombin inhibitor. It will directly attack on the thrombin synthesis. Clear? So indirect thrombin inhibitors are heparin. Next is enoxaparin, deltaparin, prenaparin, reviparin, nedroparin, danaparoid, and last is your fondaparinux. You can just see a common thing: parin, 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 parin. Every year you can see the parin word. From parin you can understand that it is a parenteral drug. It is a parenteral drug. Clear? Okay. Next is your direct thrombin inhibitor that contains two drugs, that is bivalirudin and your agratroban. Next is oral anticoagulant that is given orally. Example is, next classification is vitamin K antagonist. As you know, vitamin K is responsible for your coagulation of the blood, or the process that will coagulate your blood. So either we will directly inhibit the vitamin K synthesis, automatically your body will work as the anticoagulant, your blood will coagulate. Clear? So next is option correct examples are bis-hydroxycoumarin, also known as dicumarol, and this was our correct answer. Next is warfarin. Next is your acinocoumarol, ethyl biscow acetate. ठीक है. Next is your direct factor 10 inhibitor. This is your factor number 10. The clotting factor, factor number 10. Inhibiting the factor 10, the two drugs inhibited, that is rivaroxaban, next is epizaban. Oral direct thrombin inhibitor, this was parenteral, this is oral. The option only drug is dabigatran. Clear? This is the your whole classification of your anticoagulant drugs. Clear? Okay. Now let's move on to the another question. Beta blockers act by. Okay, first of all you need to understand what are beta blockers. There are two types of beta receptors, beta 1 and beta 2. From this one you know that we have a single heart. So beta 1 receptor is present on your heart and beta 2 is present on your lungs, because we have two pairs of lungs. So this is present on your lungs. Now you can see everything, the words, these words are related to your heart. Okay. Now the beta blocker, this blocker means the heart has the function to pump. Clear? So it will block the action of your heart. That means it will decrease the heart rate. Obviously blocking means it will work against the action. So it will decrease, no increase action will be going. So all the three options automatically gets wrong. Only the correct answer is it decreases the heart rate. Clear? Okay. Next question. Centrochromin is present in which oral contraceptives? What is the oral contraceptives? First thing which is given orally. Contraceptive is used at the time when we are not in a mind to conceive or to get pregnant. Clear? So this product, that is centrochromin, a chemical substance, is present in which of the following drugs? As you know, Saheli, Mala D, Mala and Angina pill, all are the contraceptives. But the Saheli consists of centrochromin. Also it is a non-steroidal product. Clear? Clear? The correct answer will be Saheli. Okay. Now the next question. Which of the following antibiotic and their mechanism? Match the following antibiotic and their microorganisms. Means the antibiotic are made from the very responsible microorganisms. So streptomycin antibiotic are produced by Streptomyces gravis. Next is rifampicin. Rifampicin is produced by Streptomyces mediterraneae. Clear? Next is gentamicin is produced by Micromonospora purpura. Next is neomycin, produced by Streptomyces faradeae. Clear? So we will match like these because these are the answers. So option will be P first, Q second, R third and S fourth. So option number D is your correct answer. There is no such tricks to remember the microorganisms. You need to revise it. You need to learn it. Okay? Okay. Now the next question. Antidote for heparin is, okay, like you know, whenever a foreign antigen enters our body, in response to that, our body produces antibody. Same the case is here also. Whenever you are getting overdose or you are poisoned with something, then to treat that we use the antidotes. Clear? Understood? Now heparin is what? Heparin is an anticoagulant. In case you are getting the overdose of heparin, it can be treated with protamine. It can be treated with protamine. EDTA is responsible to treat your lead poisoning. Clear? That is a chelating agent. Correct answer will be your protamine. Let's just see a table and it is very important. Just remember. Try to remember. Okay? Atropine poisoning is treated by phytostigmine, benzodiazepine, flumazenil, morphine, naloxone, organophosphate, atropine, opioids, naloxone, insulin, glucagon, isoniazid, pyridoxine, carbamates, atropine, lithium. Hemodialysis can treat the overpoisoning of your lithium. Hydrogen sulfide, amyl nitrate, scorpion sting, prazosin, paracetamol overpoisoning, N-acetylcysteine, ethylene glycol, fomepizole, iron compounds, desferrioxamine. Next is heparin poisoning is treated by protamine sulfate antidote, digoxin immunofab, beta blocker, glucagon and calcium, calcium channel blockers, calcium chloride, carbon monoxide, hyperbaric oxygen, because only the oxygen can replace your carbon monoxide produced at the time of your fire condition, burn condition. Okay. Next is methanol, ethyl alcohol, fomepizole, warfarin, vitamin K1, theophylline or caffeine, esmolol, salicylates, alkaline diuresis with sodium bicarbonate, lead, that is EDTA, alkalis, that is vinegar, methemoglobinemia is treated with a high dose of oxygen and methylene blue, serotonin syndrome, that is criproheptadine, or you can use chlorpromazine. Next is cyanide, oxygen plus amyl nitrate plus sodium thiosulfate. You can take the screenshot of this chart and you can revise it because the direct questions can come from this very particular topic. Okay? Okay. Let's move on to the next question, that is cyclophosphamide is a anti-cancer drug. Okay, it acts by alkylating nature. Clear? It is a anti-cancer drugs, works on the principle of alkylation. Okay. Next question, diabetes insipidus occurs due to diabetes insipidus and diabetes mellitus. Diabetes mellitus is a condition where you can see the higher level of sugar content in your body, that is diabetes mellitus, known as diabetes. Next is diabetes insipidus. It occurs due to the deficiency of your antidiuretic hormone, and your antidiuretic hormone example is vasopressin. And what does this does? Actually, this antidiuretic hormone, or you can say in the condition of diabetes insipidus, the urine output is frequently just the double of the normal range. So, all your water content present in the body is just removed, and also your body gets concentrated, especially your sugar content. Clear? So to dilute it, to regain the water reabsorption, the anti-diuretic hormones is responsible, means vasopressin, and the deficiency of this will lead to your diabetes insipidus. Clear? Okay. Now the next question, which one of the following drugs has positive inotropic and negative chronotropic action? What does this mean? Inotropic terms mean inotropic is responsible for the contraction of your heart muscles. This is the contraction of your heart muscles. The positive inotropic means the increase in the contraction. The negative means the decrease in the contraction. What does this chronotropic means? Chronotropic means the heart rate, and the positive chronotropic means increase in the heart rate. Negative chronotropic means decrease in the heart rate. Next is demotropic. Demotropic means your electrical impulses. Now the positive demotropic means increase in the electrical impulses. Negative means decrease in the electrical impulses. Now which drug has these both action? Actually digoxin works on the principle of these. Digoxin is your congestive heart failure drug, means it is used at the time of congestive heart failure. How? At the congestive heart failure time, actually what is congestive heart failure? The condition where your body cannot contract or your heart cannot contract and it will lack in the supply of blood. That is congestive heart failure. Now to treat this contraction, less contraction, we will give a person positive inotropic because we want to increase the contraction. So we will provide positive inotropic drugs. Okay, but suddenly giving this positive inotropic drug can lead to excess muscle contraction, heart contraction, and that will lead to the increase in your heart rate as well. Okay, this increased heart rate can lead to your heart attack also. So to cure this, to balance this, we will give the negative chronotropic drug. This means this digoxin has both the properties of positive inotropic and negative inotropic to treat your congestive heart failure. I hope you are clear with your concepts. Clear? Okay. Now the next question, narcotic cough suppressant used to relieve cough. Narcotic cough suppressant. Narcotic means which causes sedation, okay, which causes sleepiness. So codeine, you are very familiar with this codeine. It causes the sleeping or your sedation problem when it is consumed, and it is consumed for the condition of your cough suppressant. When you have a cough, you use the syrup that is codeine, that contains codeine. So at a time I think now it is banned. Clear? Due to it has the high sedation properties. Okay, clear? Correct answer will be codeine. Now the next question, all of the following are indirect thrombin inhibitor except. These all are your thrombin inhibitor except, and that too indirect. So heparin, now fondaparinux and enoxaparin, these three are your indirectly acting thrombin inhibitors. Thrombin is a compound that is responsible for the clotting of your blood, and when these heparin doesn't act directly on your thrombin, it acts indirectly, but your ergotroban acts directly on your thrombin. This is direct thrombin inhibitor, and these three are indirect thrombin inhibitor. Clear? See, next question, a drug that decreases the activity of another drug is called. A drug that increases the activity of the drug, which means that supports the drug, is your agonist. and the drug which acts opposite of the agonist means it will decrease the activity of the drug is your antagonist, the opposite of your agonist. Next we have the adverse reaction, the reaction which is not favorable for us, that is not a desired effect, is your adverse effect, the opposite of your desired effect. Next is synergic. What does the synergic means? When a one drug is not capable to show the proper effect or the desirable effect, it is combined with the another drug. For example, aspirin and caffeine, both are given at the combined to produce the efficacy or the desirable amount of effect we need. That is your synergic condition. So what will be the answer? The answer will be antagonist. Clear? Okay. Now the next question. All of the following drugs are class 1 anti-arrhythmic drugs except. Here we have the word except. And what does the arrhythmia means? Have you ever seen the electrocardiogram? How does it shows? It shows our heartbeat like this. Clear? What is this? This is the rhythm of your heart. And disbalance in the rhythm is known as arrhythmia. Clear? And to treat this disbalance, we use the drug anti-arrhythmic drug. So, you can understand this 𝘿𝙎𝘏. This 𝘿𝙎𝙏, whenever it is present at the last of any word, that describes that this is a beta blocker drug, and rest all are your class 1 anti-arrhythmic drug. So, this is your beta blocker drug. And also this beta blocker drugs comes under the class 2nd. Clear? These are the classification. Class 1 is your sodium blocker. Next, class 2 is beta blocker. Class 3 is potassium blocker. And class 4 is your calcium blocker. Clear? Okay. Next question. Sulfonylureas decrease sugar level. See, understand the question. Just divide the words and you will get your answer. Sulfonyl, here you can identify the term urea. Here decrease in your sugar level means somehow the urine has the high amount of sugar level, and this sulfonylureas is responsible to decrease the sugar level. And how your body will decrease the sugar level? There is one condition only. It has to produce the more insulin that is produced by beta cells of your pancreas. So, now this sulfonylureas will work on the mechanism that it will increase the synthesis of your beta cells that will produce insulin, and the insulin will use these sugars and will decrease the level in the body. So, what will be the answer? Release of insulin from beta cells. That is the mechanism of action of your sulfonylureas. Clear? Understand? Easy? The question itself says the answer. Clear? Okay. Now, next question. Which of the following is a plasma kinase? Now, this plasma kinase is responsible for the contraction. Clear? This is responsible for the contraction. If there is decrease in this plasma kinase, we used to take the drug 𝘾𝙀𝙉𝙏. Clear? This is simple. This is the classification. It should not have no concept. Okay. So, the correct answer will be your 𝘾𝙀𝙁. Clear? So, these were the 16 questions of pharmacology. Now, next we have the questions, 8 questions from your human anatomy and physiology subject. Let's see the first question. The study of organs or viscera are also known as. Okay. Here we have osteology, and osteon. What is the osteon? That is the bone cells which produces osteocytes, and further it matures to osteoblast. So, this osteology, logy means study of. Study of. Osteo means bones. So, study of your bones is osteology. Logy means study of. Sphenco means the study of the organs or viscera is sphenchology. Cardio means heart, study of heart. Ophthalmo, you have seen the word ophthalmo at the respective in the condition of your eye drops. So ophthalmology means study of your eye is ophthalmology. Clear? The correct answer is sphenchology. Clear? This is histology, study of tissues. Myology, study of muscles. Neurology, study of nerves. We have next endocrinology, endocrine system. Otology, ear. Odontology, teeth. Hematology, blood. Clear? Okay. Next question. Which of the following is graveyard of RBC? Graveyard of RBC. At after the 120 days, lifespan of 120 days, your blood cells, especially your RBC, gets into your spleen for the destruction process, and also it produces or gets distributed into proteins, irons and the bilirubin. Clear? So it happens on your spleen. Clear? Okay. Correct answer is your spleen. Now the next question. What is the covering of heart known as? There are two things. One is the lining, that is the inner lining of your organ. Another is the covering. That means the layer which covers your particular organ is known as covering. So the covering of heart is your pericardium. This cardium means your heart. Pericardium means the peripheral surface, the out periphery of your heart is your pericardium. Okay, this is the membrane. Pleura, this is the covering membrane of your lungs. Meninges is the covering of your brain. Peritoneum is the covering of your bones. Clear? And the correct answer will be your pericardium. Okay. Now the next question. Kupffer cells are found in your liver and it is responsible for the macrophagic activity. ठीक है? It protects your liver from the bacterial damages. Clear? Okay. Now the next question. Which of the following is not a bone of the axial skeleton? Not a bone of axial skeleton. Your skeletal system is divided into two types. Your skeletal system is divided into two types. One is axial and another is appendicular. The axial bone consists of your brain, vertebral column and your thoracic cavity. Your appendicular consists the rest of the part, that is your collarbone, your shoulder blade, your upper limbs, your pelvic area as well as your lower limbs. These comes under your appendicular bone. Now pectoral girdle. What is this pectoral girdle? This is your collarbone and your scapula, that is clavicle and scapula comes under pectoral girdle. So this is a type of your appendicular bone. And rest all, that is ethmoid. Ethmoid bone is a type of your cranium bones. Sphenoid is a type of your cranium bones, and hyoid is present at your throat and is a type of axial skeleton. So the question contains not, means the pectoral girdle is not a type of axial skeleton. It is a type of appendicular skeleton. Clear? Clear everyone? Okay. Next question. What is the biggest part of the brain? Our brain contains many parts. First we have the cerebrum, then we have the cerebellum known as the small brain, little brain, and we have the brain stem. The cerebrum is the biggest part of our brain as it contains your memories, as it is known for the excellence. So this is the biggest part, and the cerebellum is responsible for maintain the balance of your body. Clear? Okay. The correct answer is cerebrum. Clear? Next question. Select the mismatch pair. Okay. Thyroxine, thyroid gland. Testosterone, testes. Okay, this is the correct pair. Estrogen, ovary, correct pair. Adrenaline, pituitary gland. No, adrenaline is synthesized not by the pituitary gland but by your kidney, that is adrenal cortex produces your adrenaline. Clear? This is the incorrect pair. Clear everyone? Okay. Now the next question. Which of the following is heterocrine gland? Now what is the heterocrine? Heterocrine means the condition where your organs or the gland works both the types. It has the work with endocrine and exocrine both. Endo means, that means it releases the hormones or hormones into your bloodstream, and exocrine means it uses the duct, that is especially the juices are secreted and the juices are the type of your exocrine part. Okay, now the sweat gland produces sweat. Does it have any relation with your blood involvement? No. So this is not the endocrine but this is the exocrine. So it is not a heterocrine. We need the organ that is both. So we have our pancreas. How? These pancreas produces insulin, which is a endocrine, but also these pancreas produces pancreatic juices, that is your exocrine. So this is both the activity of endocrine as well as your exocrine. The correct answer will be your pancreas. Clear everyone? Okay. The next question. Okay, these were the 8 important questions of human anatomy and physiology. Now we have the 8 important questions from our biochemistry subject. Let's start. Which sugar is carried by the blood and used by the tissue? Have you ever seen or heard maltose? This is also known as the table sugar. Have you ever heard that this has any relation with your tissues? No. Starch. This is not involved or used by our tissues. Hyaluronic acid. This is absorbed in our skin but doesn't absorb by our tissues. Next is the glucose. Yes, the glucose is responsible to maintain the sugar level as it is absorbed in our blood and used by tissues to produce energy on the working of the tissue. Clear? So what is the correct answer? The glucose is the correct answer. Okay. Now the next question. Fehling test is identify the which type of sugar. There are 3 tests, that is BFT, Benedict, next is Fehling, and the T stands for tumors. These 3 tests gives the positive result for your reducing sugar. And what is this reducing sugar? That means it has the free aldo and keto group. These are the reducing sugars, and the reducing sugars give positive result for these 3 tests, Benedict, Fehling and tumors test. Clear? So what will be the answer? The answer will be that Fehling test gives positive test for reducing sugar. Clear? Okay. Next question. Which type of polymer present in amylose? Okay, amylose is a type of sugar and it has linear polymer. Linear means in one line. It has the linear polymer. Clear? It has the linear polymer means in a one line, not the branched, but it has this sequence in a single line. Clear? Okay. This is the formula for your amylose. Clear? Next question. Keratin is a type of which protein? The protein is classified into many categories, 3 categories: primary, conjugated, and last is your derived. Clear? Primary has the simple proteins. Conjugated means apart from your protein, it has another group, another non-prosthetic groups. Like if we have protein, we attach lipid group, it becomes lipoprotein, has another non-group. Clear? Then likewise, if we have glucose, it becomes glycoprotein. Okay? Clear? This is the conjugated, and derived is derived from these both proteins are known as derived proteins. Now the globular protein is example of your globular and scleroprotein are the example of your primary protein. Also the keratin is the example of your scleroprotein. Clear? The keratin is the example of your scleroprotein. This is the chart. You can take the screenshot to remember. Look, nucleoprotein, nucleus group, non-prosthetic group, glyco group, muco group, lipid group, phosphate group. Clear? Metal group. Okay. Next question. Which mineral is a constituent of vitamin like biotin and lipoic acid? Which of these following minerals have the relation with your vitamin like biotin? So the mineral which is responsible is your sulfur. Clear? Sulfur has the relation with, the sulfur is a constituent of vitamin like biotin and lipoic acid. Also it is the constituent of sulfur containing amino acid. Formation of proteins like keratins is done by your sulfur. Formation of SH group containing enzymes is done by sulfur. Clear? So sulfur is a constituent of vitamin. Clear? Okay. The next question. Rancidity leads to the formation of peroxides at. What does the rancidity stands for? Rancidity stands for the oxidation process whenever your food materials comes in the contact with the oxygen, it starts degrading. Okay, so that is rancidity. Where does this rancidity shows its effect? The double bonds of fatty acids are the place where this rancidity shows the effect to destroy your food. Clear? So what is the rancidity? It leads to double bond fatty acid formation at peroxides. Clear? Clear everyone? Okay. Next question. Identify the structure name. What is this? See, one is that you have the phosphate group, you have the sugar group, and you have the amine group also. So this is the example of three bases and are the type of structure of nucleotides and nucleoside. From this side word you can understand we have to remove or we have to side one group, that is S stands for phosphate set. Okay? So this phosphate group is not present at the structure of nucleoside. This is the structure of your nucleoside and these whole are the structure of your nucleotides. Clear? Okay. Now the next question. What activity show in case of substrate concentration is increased? Which activity? So the correct answer will be the enzyme is actually responsible, or you can understand if there are, this is enzyme, this is substrate. If you have the maximum amount of substrate, it will make a complex with enzyme that is known as enzyme substrate complex. And if you have the limited substrate, then what will happen? All the enzymes are not utilized. So increase enzyme activity. If we have the higher concentration of substrate, that means more and more enzymes are utilized. So the concentration of the substrate directly is proportional to increase in the enzyme activity. I hope you are clear that if the substrate is in a good amount, the enzyme will form the substrate enzyme complex. So if you have the concentration of substrate high, the increase in enzyme activity will increase automatically. Clear? Okay. Now, next question. Okay, so these were the important questions of pharmacology, HAP and biochemistry. Now, the next subject will be taken by the rest of the faculties. So, keep watching the video.
Now we are going to see the important questions from pharmaceutical jurisprudence. Who is the current president of Pharmacy Council of India? Okay, who is the current president of Pharmacy Council of India? Now one thing remember, Pharmacy Council of India, that is PCI, it is also known as Central Council. It is also known as Central Council. Okay, and it is reconstituted every 5 years. Remember, it is reconstituted every 5 years. Okay. Now, what is the question? Who is the current president of Pharmacy Council of India? Option A is Dr. Montu M. Patel. Option B is Dr. B. Suresh. Option C is Dr. Pramod Yevle. Option D is Dr. Shailendra Saraf. Okay. So these are the options. So the current president of Pharmacy Council of India is Dr. Montu M. Patel. Okay. So option A is the right answer. Dr. Montu M. Patel. So Central Council, that is PCI, is constituted by central government and hence it is known as Central Council, and it was first constituted in 1949, immediately 2 years after the independence, and it is reconstituted every 5 years. Okay, it is reconstituted in every 5 years. The president and vice president are nominated by its members. Okay, so the members of Pharmacy Council of India, they will nominate their president and vice president. Dr. Montu M. Patel is the new president of PCI and Dr. Pramod Yevle is the vice president of PCI. Okay, so remember these important points for Pharmacy Council of India. Let's see the next question. The next question is, an inspector is appointed by the central government or a state government under the DNC Act, that is Drug and Cosmetic Act 1940, are mentioned under which of the following sections? Okay, so there are various sections under DNC Act. They are asking inspector is appointed under which of this section? Okay, so basically option A is 20, option B is 21, option C is 22, option D is 23. Okay, so the right answer for inspector, if they are asking inspector, then that is 21. Okay, if they are asking inspector, that is 21. 20 section is for the government analyst. Okay, 20 section is for the government analyst, but for inspector, option B is the right answer, that is section 21. Okay, option B is the right answer. So see here, section 20 is for the government analyst, section 21 is the inspector, which they have asked in the question. Section 22 is for powers of inspector and section 23 is for the procedure of inspector. So these are the various sections and their description. Next question is, as per the Medicinal and Toilet Preparation Act, bonded laboratory means. Okay, so basically medicinal and toilet preparation, they are making use of this alcohol, and to avoid the misuse of alcohol, because there are chances like these alcohol which are meant for the medicinal purpose, they can be misused for the drinking purpose at the lower rate. So to avoid this, there are bonded laboratories and there are non-bonded laboratories. Okay, so basically bonded laboratories means the laboratory in which you do not have to pay any excise duty. Okay, if it is non-bonded, there you will be having to pay excise duty. Okay, so the question is, in the Medicinal and Toilet Preparation Act, bonded laboratory. Okay, bonded laboratory means where we do not have to pay the excise duty. So option A is excise duty has not been paid. Okay, so option A is the right answer. Let's see what are the other options. Excise duty has been paid. Remember, excise duty we pay for non-bonded laboratories. Okay, we pay for the non-bonded laboratories. Option C is excise duty need to be paid. No, it should not be paid on the bonded laboratories. Option D is none of the above. So option A is the right answer, where excise duty has not been paid. So bonded laboratory means where excise duty has not been paid, and non-bonded means where excise duty has been paid. So this is the difference between bonded and non-bonded. The next question is, who is authorized that regulates the license under import of poison? Okay, so option A is state government, option B is central government, option C is both A and B, option D is none of the above. Okay, So for authorized regulates the license, it is import under the import of poison. It is a central government. Okay, it is under central government. So central government has the authority for this one. So it may prohibit the import of any specified poison across any defined customs. Okay, so they have this authority into India except under and in accordance with the condition of license, and may make rules to regulate the grant of such license. So central government has the authority to make the rules to regulate the grant of such license. The next question is MAP. That is nothing but maximum allowable post manufacturing expenses. Okay, so MAP should not exceed dash formulation for indigenously manufactured schedule. Okay, so MAP is nothing but maximum allowable post manufacturing expenses. It should not exceed 50%. It should not exceed 70%, 80%, and 100%. Okay, so basically the answer is 100%. It should not exceed more than 100%. So all cost incurred by a manufacturer from the stage of ex-factory cost, okay, that is apart from the manufacturing one to retailing, it includes the trade margin, margin for the manufacturers, and it should not exceed 100% for indigenously manufactured scheduled formulation. Okay, for scheduled formulation, it should not exceed 100%. That is maximum allowable post manufacturing expenses. So option D was the right answer, that is 100%. Which resin is obtained from the Indian hemp plant? Okay, so if you know the answer, please let us know. So option A is bhang, option B is opium, option C is codeine, option D is charas. Okay, so the resin which is obtained, it is nothing but charas. Okay, it is nothing but charas. So option D is the right answer. I hope most of you got this answer. So charas is a form of cannabis which is a hemp, and it is handmade in Indian subcontinent, and it is made from a resin of cannabis plants. Okay, it is made up of resins from the cannabis plants. Okay, it is a separated resin, and it is also known as hashish oil or liquid hashish because its form is in the oil form or it is in the liquid form or the resin form. Okay, so that is nothing but charas. Bhang is obtained from the leaves. Okay, leaves. So these parts are very important. Okay, like charas is nothing but resin, bhang is nothing but leaves. Okay, so this part remembers. The next question is manufacturing of Ayurvedic medicine in DNC Act are deal in. Okay, so about Ayurvedic system, Schedule X. Option A is Schedule X. Option B is Schedule T. Option C is Schedule Y. Option D is Schedule C. Okay, so basically manufacturing of Ayurvedic medicine, not only Ayurvedic medicine, but Ayurvedic plus Unani system plus Siddha system. So this is all given in Schedule T. Okay, it is given in Schedule T. So you can also remember it because Schedule T is nothing but AUS, that is Ayurveda, Unani, and Siddha system. You can also remember it as total Australia like this because this is the short form for this, so you can remember it in that way. So T indicates AUS, or you can also remember it as T for tree like that. Okay, so coming to Schedule X, Schedule X is for the psychotropic substances. Okay, Schedule X is for the psychotropic substances. Schedule Y is for the clinical trials one, and Schedule C is the for the parenteral one. So okay, so Ayurvedic one they have asked, so that is Schedule T. So Schedule T is the right answer, and that is not only for Ayurvedic, it includes Unani and it also includes Siddha system. Okay, so C is for the parenteral one. C is for the parenteral administration like surgical dressings, ophthalmic preparations, etc. T is for the requirements for factory premises and manufacturing of Ayurvedic, Siddha and Unani products. All three it includes. X is for the habit forming or psychotropic substances. It is a list of a drug having psychotropic or habit forming drugs. Schedule Y is for the requirement and guidelines for the clinical trials. Any company moving from preclinical to clinical. Clinical is nothing but the study which is done in the human. So we have certain phases, phase 1, 2, 3, 4. So Schedule Y is for the clinical trials. Coming to the next question, A medical practitioner for termination of pregnancy requires specialization in. Okay, so if any of the doctor, because of some reason, if he or she is doing any of the termination of pregnancy, what are the medical practitioner requirement? Okay, option A is gynecology, option B is obstetrics, option C is both A and B, option D is surgery. Okay, so basically both A and B is the right answer, gynecology as well as obstetrics. Obstetrics is nothing but the requirement where there will be certain medicinal areas, especially for the pediatrics, medicines will be there. So he should have a specialization in both A and B. So both A and B is the right answer for this question. So see, registered medical practitioner, that is RMP. Okay, RMP means a medical practitioner who possess any recognized medical qualification as defined in clause H of section 2. And what this clause tells us that according to Medicinal Council Act 1956, so it tells that the training in gynecology and obstetrics is required for the termination of the pregnancy under this act. Okay. Hello dear students, welcome to GDC classes English. So the next important topic from our super model paper number 3 is regarding hospital pharmacy. So the first question from hospital pharmacy is, how many number of staff pharmacists is recommended for the hospital containing bed space up to 500? Okay, so depending upon the bed size, the number of pharmacists will vary. Definitely, if we increase the bed size, the number of pharmacists will increase. So for 500 bed size, how many pharmacists are required? Option A is 10, option B is 15, option C is 8, option D is 3. So for 500 bed size, at least 15 pharmacists are required. Okay, so 15 pharmacists are required for the hospital containing 500 bed size. Okay, so 15 is the right answer for this question. Now let's see, apart from 500 bed size, we have different bed size also. So if the bed strength is up to 50 beds, if the bed strength is up to 50 beds, the number of pharmacists required are 3. The number of pharmacists required are 3. If we increase the bed size up to 500, then it will be 5. Number of pharmacists will be 5. For 200 beds, the number of pharmacists required is 8. For 200 bed, it is 8. Up to 300, it is 10 pharmacists. And for 500 beds, at least 15 pharmacists are required. So this is the pharmacist requirement based upon the bed size. Now let's see what is the next question in the hospital pharmacy. A hospital is called large. A hospital is called large if it has dash number of beds. Okay. So depending upon the bed size, it is categorized as very small. It is categorized as very small, then small, medium, and large. Okay, so depending upon the number of beds, it is categorized as very small, small, medium, and large. In case of large, if the bed size is more than 1000, if the bed size is more than 1000, we call it as large hospital. If the bed size is between 500 to 1000, if the bed size is between 500 to 1000, we call it as medium size hospital. If the bed size is between 100 to 500, if the bed size is between 100 to 500, we call it as a small size hospital. And if it is less than 100, below 100, we call it as very small. Okay. So in this case, they have asked us about the large hospital. Okay. So option A is more than 500. Option B is 400 to 1000. Option C is 500 to 1000. Option D is more than 1000. Option D is more than 1000. So for large hospitals, the bed size is greater than 1000. So option D is the right answer. That is greater than 1000. That is greater than 1000. So here you can see large hospital means beds 1000 and above. Medium hospital 500 to 1000. Small hospitals 100 to 500, and very small hospitals the bed size will be less than 100. So this is the classification of hospitals based upon the size. Based upon the size, this is the classification. The next question is advantage of unit dose system. This is UDS. Advantages of unit dose system. So this is nothing but UDS. UDS is nothing but where there is a coordination for the dispensing and the maintenance. So what are the advantages in the healthcare unit? Okay, so option A is better financial control. Option B is it prevents the loss of partially used medications. Option C is it reduces the revenue losses. Option D is all of this. Yes, so it has all of the advantages, uh, including the financial control, revenue losses, and it will also prevent the loss of partially used medication. So option D is the right answer. That is all of this. All of this is included as the advantage of UDS in the healthcare unit. So apart from this one, we have it does not require storage facility at the nursing station. It also eliminates the labeling errors. There is an accurate medication charges. And apart from that, there is a preserved space in nursing units by removing the bulky floor stock. So all of the floor stock is removed and thus creating the space in the nursing unit. So these are the different advantages of UDS. The next question is, who frames policy guidelines regarding entry or deletion of drugs from hospital formulary? Okay, so there are certain guidelines who will decide the deletion and the entry of the drugs into the hospital. Okay, so A is administrator, B is governing body, option C is medical committee, option D is PTC, that is pharmacy therapeutic committee. Okay, so yes, PTC decides that the entry and the deletion of the drug from the hospital formulary. So PTC is the right answer, that is Pharmacy Therapeutic Committee. So they frames the guidelines. They frames the guidelines and it is responsible for establishing the drug policy and the formularies for the hospital. It frames the guidelines for drug selection, use and the monitoring. Okay, so it frames the guideline for this one and it is an ongoing basis where objectively appraises, evaluate, select medication for addition and deletion. Okay, so PTC decides, they frames the guidelines for the entry and the deletion of the drugs from the formulary. A chairperson of PTC is appointed from. Okay, so PTC is a committee where there will be a nurse, a pharmacist will be there. So who will be the chairperson for the PTC? Option A is physician. Option B is nurses. Option C is patient. Option D is administrator. Okay, so there will be three physicians in the PTC. In this committee, there will be three physician, out of which one will be appointed as a chairperson of PTC. Okay, so one will be appointed as chairperson. So option A is the right answer, that is physician. Okay, apart from these three physician, one will be appointed as the chairperson of PTC. So this is a composition and organization. Let's see what are the faculties present in the PTC. First is physician. First is physician, where chairman will be there. How many chairman? How many physician will be there? Three physician. Out of this three, one will be the chairperson of PTC. Out of this, one will be the chairperson. Pharmacist will act as secretary. Pharmacist will act as secretary of the PTC. One will be the number. So one pharmacist will be there and he or she will be acting as a secretary. Next is administrator. So administrator will be a member. So one administrator and one nurse acting as a member of the PTC. So this is the composition and organization of PTC. Which is the significance of hospital formulary? Okay, so hospital formulary is made depending upon the considering all the factors like the therapeutic, the safety of the patient, the efficacy and everything. Okay, so option A is therapeutic, option B is economic. Yes, it reduces the whatever the charges will be there, educational and all of this. So these are the advantages of, this is the advantage of hospital formulary. So yes, it includes the therapeutic, economic and the educational. So option D is the right answer. So this is the advantages. First is therapeutic, economic, educational and rational use of the drug. Apart from that, safety also included. So these are the advantages of the formulary. The next question is, encyclopedias are which source of information? Okay. So basically there is a primary source of information which is basically collected from R&D, that is research and development. There will be a secondary source from where articles information, some review articles will be there, and there will be a tertiary information where it will not directly give the information but it will definitely point towards it. So we have certain encyclopedias and etc. So these are the primary, secondary and tertiary source of information. Now let's see encyclopedia. They have asked it is a source of which type or which information. So we know that primary information it includes which is generated from the research one, secondary information is from the articles and tertiary is from the encyclopedia. So option A is primary, option B is secondary, option C is tertiary or all of the above. Okay. So encyclopedia comes in the category of tertiary source of information. Encyclopedia comes under the category of tertiary source of information. So tertiary is the right answer. So primary source it is given by author or this information originates from research and development. The secondary source which will include certain formularies, pharmacopoeia, textbooks and articles. Tertiary source will include your encyclopedias, and apart from encyclopedias you will also have some dictionaries available. So these are the different sources of information. Zinc oxide bandage is, okay, zinc oxide bandage is adhesive bandage, impregnated bandage, elastic bandage, non-elastic bandage. Okay, adhesive bandage means it will be sticking. Adhesion is nothing but sticking. Okay, adhesion is nothing but sticking. Whereas impregnated, the name means it will be a soaked or it will be a saturated one. It will be soaked or it will be a saturated with something. Okay, so zinc oxide comes under impregnated bandage where it will be having certain cotton wool and it is impregnated with zinc oxide paste. Okay, it is saturated with that one, so it comes under the category of impregnated bandage. It is not elastic bandage or it is not under a non-elastic bandage. So option B is the right answer, that is zinc oxide. So it comes under the category of zinc oxide. So it is a cotton fabric of plain weave which is impregnated, that is saturated or soaked, containing a zinc oxide. So it will be having certain paste which will have a zinc oxide. So it is used to support and prevents the swelling, fractured limbs after the removal of the plasters. Okay. So these are the, whereas adhesive bands it will be bandage, it will be used for healing of the wounds, and zinc paste it is used for to prevent the swelling after the plaster has been removed. So these were the questions for hospital pharmacy. Now let's see the important questions from pharmaceutics. The very first question is, preparations like infusions, decoctions, spirits and elixirs, commonly known as, okay, so these are the preparations which comes under the category of galenicals. Okay, it comes under the category of galenicals and it comes from the word galen. Okay, but nowadays it has not been used, but galenicals, they are the herbal extracts. Okay, they are the herbal extracts and it comes from the name of galen. Okay, so these are the preparation, they are the herbal extracts. Okay, elixirs, they are nothing but hydroalcoholic solutions. So they are not pharmaceuticals or nutraceuticals or cosmeceuticals. They are the preparations and they are considered as galenicals. So the word galenicals, it is obtained from the name of the person, that is Galen. Okay, it is obtained from the name of the person, that is Galen. So these all are the preparation, they are known as galenicals and they are used in the herbal medicine when compared with the synthetic drugs. Okay, they are used in the herbal medicines. The demand is decreasing because the advantage of this preparation, it is presence of different active ingredients of that particular extract. Okay, and rather than single pure principle, so it contains a combination, and it is rarely used because due to high cost nowadays it has not been used that much, and it is also a time consuming process. Okay, so it was a traditional method. Now match the following. Okay, so here there are different meals they have given, and here the principles of that particular meal is given. Okay, the principle of particular meal is given. Now what is the first meal? Roller mill. Okay, we know that in case of roller mill there are two rollers. Okay, and the mill is nothing but for size reduction. Okay, these mills are nothing but for size reduction process, right? So whatever the powder material will be there, that will come in between these rollers, and it will get compressed. Between this roller it will get compressed and size reduction will happen. So this is the first one, that is a roller mill. This is for the roller mill. The second mill that is given is hammer mill. Okay, so the second one is a hammer mill. So in case of hammer, whenever a particle will strike to a harder surface, okay, for example, this is a surface and this will be a particle striking, we call it as impact. We call it as impact. So hammer mill comes under the principle, or the principle of hammer mill is impact. Okay. The third one is ball mill. Okay. Now in case of ball mill, a small balls will be present, right? A small balls will be present here. So when a particles will strike two balls, so it will cause both impact, where your ball will behave as a harder surface, and when balls will roll over each other, it will also cause the accretion, right? It will also cause the accretion. So it will have both impact and accretion. The fourth one is related to edge runner mill. So edge runner mill, it's nothing but it will have cutting action. Okay, whenever it is cutting, so it is nothing but shearing. So if we match them, so the roller mill, it is based upon the principle of compression. So first C is the right answer. Let's see what are the options having first as a C option. So only here it is having first C. Rest of the option they are not right for first one. Let's see for hammer mill, second option D they have given. So yes, impact is the right answer. Third, accretion and impact for ball mill. And fourth is the B, edge runner, that is crushing and shearing. So option B is the right answer for, these are the different principles for different mill. So here you can see cutter mill, it is for the cutting action. Roller mill, compression, the particles will get compressed between two different rolls. Hammer mill, so impact will be there. Ball mill, impact and attrition both will be there. Fluid energy mill, again it will have attrition and impact. Edge runner and end runner both will have crushing and shearing. Colloidal mill, it will have a shearing action. So this is the product size and their uses. And some mills, they are restricted to particular material and they cannot be used to different materials. So this is about different types of mills. Vitamin tablets are generally formulated as, okay, vitamin tablets, so they are generally formulated as, option A is hypodermic. Now hypo means what? Below. Hypo means below, right? Dermic means skin, right? So these hypodermics, basically they are given as tablet solutions. Under the skin they are injected, and it has to be prepared under the sterile solution. It has to be prepared under the sterile solution or the sterile conditions. Then we have sublingual. Sub means again below. Lingual means tongue. So if we want a fast action, so in that case we are giving generally in heart conditions. Effervescent tablet which will release certain gases like carbon dioxide and chewable tablets. Okay, it will contain some sugar material or the sweetening agents. So vitamin tablets, it is used as a chewable, it is generally formulated into a chewable tablets. Okay, because in this case we require certain action, fast action. So it is not a hypodermic, we are not injecting it into the skin, neither it is given as sublingual or effervescent. It is formulated as chewable tablet. It is formulated as chewable tablet. So it is a rapidly disintegrating. It will have a burst release because it is getting chewed in the mouth itself to achieve the fast onset of action. Okay, and this is designed for the patient who are unable to swallow the tablets. Okay, so for them it is designed for the chewable action, and it is non-hygroscopic. Okay, so that means it will not take any of the moisture content, and it is used in the vitamin formulation. Okay, so generally the drugs suffering from the moisture sensitivity. So this is regarding the chewable tablets. In capsules, 𝙂𝙎 is used for. 𝙂𝙎 is nothing but the name of instrument. Basically, it is for the filling material. Okay, it is for the filling material. What kind of material can we fill? We can fill powder into this one. We can fill pellets. We can also fill some mini tablets into the capsule, or we can also fill some granules. So 𝙂𝙎 is the instrument used to fill all of this formulations. Okay. So option A is filling of pellets. Option B is polishing capsules. Option C is filling of liquids. Option D is bulk powder. Now we know that this is a filling equipment, right? So either option A or option C has to be the right answer. But in option C, liquid is given, but 𝙂𝙎 is for filling of the pellets. So option A is the right answer. So filling of pellets is the right answer. So these are the different instrument and their uses. Hofliger and Karp is for bulk powder. Osaka is based on the vibration principle. Perry is also for the bulk powder. Ellilini and Park Davis, so that is for pelletized or granular material. 𝙂𝙎 is for all powder, pellet, granules and the tablet. Pharmatic is also pharmatic and Macopher. Both are for bulk powder. Mg2 is the continuous motion filling of a powder. So, and their speed is given in terms of minutes and hours. So these are the different instrument and what are the materials that can be filled. Now, Whitfield ointment is prepared by which of the following method? Okay, so there are three different methods for preparation of ointment. The first is fusion method. Fusion means when the substances are mixed and they are melted. Okay, so fusion means melted at certain temperature. Then we have some trituration method, then chemical reaction method, when you will add certain ingredients. If any chemical reaction is happening, that comes under chemical reaction method. Okay, so Whitfield ointment, it is basically prepared by trituration method. Okay, it is basically prepared by trituration method. So we'll see the different methods. So fusion method, so it is when different molecules or different excipients, they are mixed together and they are melted multiple ingredients, especially when ointment base contains number of solid ingredients. So in case of ointment preparation, we have ointment base, and if we are melting that, that comes under your fusion method. The example is simple ointment IP. Okay, the example is simple ointment IP. Trituration method, it is applicable for most of the medicated ointments containing insoluble drugs. Okay, so if the drug is insoluble, it is first triturated with other ingredients to form the ointment. Okay, so compound benzoic acid ointment, BPC, it comes under the trituration method. The next is chemical reaction method. So example is strong iodine ointment, that is veterinary C. It is the example of ointment which is the preparation based upon the chemical reaction method. Okay, so these are the three different preparation methods for ointment and their particular example. The next question is, which is incorrect statement for flocculated type of suspensions? Okay, so flocculated type of suspension means where there is floccules, that is a loose aggregate of the particles. They are the loose aggregate of the particles and they will form a loose floccules. Okay. So because 2 to 3 particles are coming together, they have the rapid sedimentation, right? They will have a rapid sedimentation. But they will redisperse easily, right? Redispersion is easy in the flocculated type of suspension. One particle will settle slowly, but if there is a group of particles, it will settle rapidly, right? So let's see what are the options given, and we have to identify incorrect statement. Please remember these terms, okay? We have to identify incorrect statement. Option A is particles form loose aggregated structure. Yes, particles form the loose aggregated structure. So option A is the right statement for the flocculated. Sedimented is loosely packed. Yes, whatever the sediment will be there, that is loosely packed, so that after dispersion it will redisperse easily. So B is the right statement. Sediment is formed slowly. Whether sediment will form slowly? No. It is a rapid formation. It is a rapid formation because 2 to 3 particles are coming together. So it is a rapid formation. So option C is the incorrect statement. Let's see option D. Sediment is easy to redisperse. Yes, because it will form a loose cake. Whenever a patient will try to redisperse the formulation, it will become easy to break those particles because it will form a loose cake. So option C is the incorrect statement for this question. So this is the difference you can see. Flocculated, it will settle as a flock, that means a loose aggregate, because of which the supernatant will be clear. It will settle down rapidly, uniform distribution, but it is not recommended for parenteral. Okay, it is pharmaceutically acceptable for orally, but not for parenteral because there is a size limitation when we are administering to the parenteral routes. Okay, and they exhibit plastic or pseudoplastic flow. Whereas deflocculated, they will have a cloudy appearance. They will form hard cake which is difficult to redisperse, right? And they will exhibit the Newtonian when the concentration is less, right? The next question is, which type of incompatibility best describes the formation of eutectic mixture with menthol and camphor when they are triturated together, okay? Incompatibility means either it can be drug excipient incompatibility, right? That means when two materials or two substances will come together, there will be some changes, okay, and that change is unacceptable, okay. So that comes under incompatibility. So it can be your physical incompatibility, it can be the chemical or therapeutic. Physical means the physical nature will change. Chemical means some chemical reaction will happen. Therapeutic incompatibility means either they will increase the therapeutic activity of other substance or it will decrease, right? So we know that when menthol and camphor they are mixed together, they lead to the liquefaction. Okay, they lead to liquefaction. That means when they are mixed together, it will liquefy, right? And this is what? This is nothing but the physical change that is observed. This is nothing but physical change that is observed. So it comes under the physical incompatibility. Okay, it comes under the physical incompatibility. So when two or more substances combine together, physical change will take place and this is unacceptable in the product. So apart from this, it involves any immiscibility, means when two substances are not miscible with each other. Insolubility, that means solid and liquid are not soluble. Precipitation means once the drug is dissolved, after a certain time it will start precipitating out, or liquefaction of solid material. Okay, so this comes under the physical type of incompatibility. Okay, so here menthol, camphor, it is given as the example. The next one is rubber closures. Rubber closures are washed with hot solution of dash. Okay, so option A. So here you can see only the percentage is varied. sodium pyrophosphate in water is constant. Okay, in all of them it is given as sodium pyrophosphate in water. Okay, remember this is the inorganic substance and this is water soluble. Okay, this is water soluble. And the chemical formula is Na4P2O7. Okay, Na4P2O7 is nothing but sodium pyrophosphate, or it is also known as tetrasodium. It is also known as tetrasodium pyrophosphate. Okay, tetrasodium pyrophosphate, because 4 molecules are present of sodium. Okay, so option A is 0.3% of sodium pyrophosphate. We are talking about rubber closures. Okay, 0.3% of sodium pyrophosphate, 0.2% of sodium pyrophosphate, 0.1% or 0.5%. Okay, it is used in bleaching solution or cleaning of the substances. So 0.5% is the right answer. We are using 0.5% of sodium pyrophosphate. Okay, we are using 0.5% of sodium pyrophosphate. So it can be washed. The rubber closures can be washed with the 0.5% of sodium pyrophosphate in water. So these are all the questions regarding hospital pharmacy and pharmaceutics.
In this part, we are going to cover the questions from the social pharmacy as well as the pharmaceutical chemistry that include all the syllabus of your pharmacist examination. So dear student, you just have to watch this video and there is a need to do the hard work once. Like you have to do hard work once and your one time hard work give you the comfortness pleasure for a long time. So it up to you, like you can do the hard work once, or like you are just doing the like you are living in a comfort zone and unaware, or we can say unseriousness showing all the day, all the time. So your efforts of hard work is going to decide your future pleasure. Try to lose your comfort. Please take away from yourself from your comfort. Means like you just have to plan your day, or we just comfort. It doesn't mean like I am saying like you just have to read and write like sitting on the sitting like in the direct sunlight or in the like winter just outside the room. No, comfort means like just avoid the necessary things by like using of the mobile phone, using Instagram, Facebook, WhatsApp. So just try to avoid all the things, and it's personal suggestion from my side. Please switch off all the notifications except the WhatsApp. Like WhatsApp, you will get the we can say important message from the department of any other place. But all the other notification, either it's from the YouTube, Instagram, Facebook, Snapchat, Telegram, please switch off all the notification, because sometimes the we can say mobile ring and then your presence of mind is going to be divert from your studies. Got it? So first question for today's like discussion: what is the characteristics clinical presentation of trachoma? Clinical presentation of the trachoma, as the name indicates, trachoma means somehow it is leading to trachomosis, or like option we have like skin lesions and nodules, respiratory symptoms and cough, fever and joints pain. Next you have the scarring of the conjunctiva and the eyelids. So trachoma are having the clinical representation, like there is a scarring of the conjunctiva as well as the eyelid. So clinical presentation of schema is like scarring of the conjunctiva and a thin transparent tissues covering the white part of the eyes and the eyelids. So typically the progress through a several stages, starting from just like the inflammations of the conjunctiva and leading the sclerosis over time, and the eyelids turn inward and the causes them to rub to the cornea and leads to the corneal abrasion, also ulcer and ultimate blindness if it is untreated. Got it? So you have to wash your eyes like when you wake up early in the morning and before going to the bed, or even like you just come we can say from outside to your home. Every time you just have to like clean your we can say face by the normal tap water. Next question for you, like which is the characteristic symptoms of the tetanus? Characteristic symptoms of the tetanus. As you know, tetanus, that is, we can say, uh, we have the tetanus, and we have the tetanus vaccine, that is basically tetanus toxoid we have. So basically in your examination you have two toxoid. One is your tetanus toxoid and second is your diphtheria tetanus, diphtheria. So tetanus, that is basically having the characteristic symptoms like fever, like muscle stiffness and the spasm. So muscle stiffness and the spasm, and it is caused by the bacterial. As you know, it is a bacterial disease having the symptoms like muscle stiffness and the spasm in the muscles caused by the bacterium, that is Clostridium tetani, which produce a toxin that is going to affect the nervous system. And like normal regulation of the muscles contraction, or we can say leading to the wrong muscles contraction and stiffness. Like this is a contraction of our muscles, but if it is going to happen for a long time, then it is we can say it is called as tetanus. Sometime like the bacteria of the tetanus is living like on the, we can say, metallic things, or we can say on the soil also. So even like if your body surface is coming in the contact, or like it is your upper layer is going to be affected, or your blood is in contact of the environment, like from the sharp, we can say sharp edge of metal, either it's from the, we can say, ground, or we can say soil, then you have to take the vaccines of the tetanus also. Even 𝘿𝙬𝙎𝘎 is also the symptoms of the tetanus. Got it? Then after next question, like how is leprosy primarily transmitted? Leprosy primarily transmitted, as we have two type of leprosy, that is possibacillar and multibacillar. So in which like skin lesions can happen in a person, like if the skin lesions is 1 or 2, then it is called the possibacillar. If the skin lesions is like 2 to 5 or more than 5, it is called as we can say bacillar. So there is a particular treatment for the leprosy. Rifampicin is a drug, clofazimine is a drug that is used in the we can say leprosy treatment. So leprosy, that is a skin infection that is transmitted by the direct contact with the infected individual. Got it? So leprosy is also known as the Hansen disease, and it is primarily transmitted through the direct contact with the individual. So we have the leprosy awareness program that has been launched by the Indian government, as well as Indian government is going to provide the useful things like if someone's parents are having leprosy, so their children are giving the we can say good education. Even their children are isolated, and they are having the separate like charity hospital. They are having the separate charity school also. Even the parents, or you can say the person that is having the leprosy is take away from the society and sent to a particular area or particular department hospital for the treatment also. And leprosy, you know very well, it is caused by the bacteria, that is Mycobacterium lepra. And as I told you, it is transmitted by the respiratory droplet, or we can say when an infected person come with the untreated leprosy, or we can say when an infected person come with the infected person come with the untreated uninfected person. Got it? So in this way that leprosy is going to be transmitted. Next, like you have to tell us like which is the causative agent of gonorrhea. So student, you just had to read the questions, then take a pause of 2 to 5 seconds, then think like what exactly examiner is asking. So causative agent of gonorrhea. Okay, you have the option like Treponema pallidi, and next you have the Chlamydia trichosis, next you have Neisseria gonorrhoeae, and next you have the human papillomavirus. Got it? So you know very well Treponema pallidi, that is the syphilis, Chlamydia trichomis, that is chlamydiasis, Neisseria gonorrhoea. Okay, next you have human papilloma, so there is papillomavirus disease. So there is only the one option, that is Neisseria gonorrhoeae. So that is the causative agent of the gonorrhea. Got it? So if you are going to puzzle in any question, just try to use the, we can say, skipping method. I will tell you in the upcoming questions like how to use the skipping method. So causative agent of gonorrhea is your bacterium, that is Neisseria gonorrhea. So it is also the sexual transmitted infection, as we have the HIV, that is primarily affected by the mucous membrane of your genital tract, but it can also infect the mouth, throat, eyes, and the rectum also. Got it? After that, you have next question like how is HIV primarily transmitted? HIV primarily transmitted? So you just have to tell me how HIV primarily transmitted. Through the respiratory droplet, okay. By sharing the food or utensils, okay. Via sexual contact, blood to blood contact, and perinatal transmission, okay. Through the contaminated food and water. As you know, there is a chance of affecting of HIV by all the reason that is mentioned below, but the major or primarily cause of transmission is via the direct in contact with the we can say direct contact of the blood to blood, as well as sexual contact and prenatal transmission also. Prenatal transmission means like from the infected mother to the fetus, or during the pregnancy, during the childbirth, if there is a direct contact of the blood also. So HIV, that is human immunodeficiency virus, that is primarily transmitted, we can say primarily transmitted through the blood contact, blood to blood contact, perinatal transmission also. So sexual contact, it is transmitted through the unprotected sexual intercourse with an infected individual, include vagina, anal and oral sex also. Blood to blood, if the syringe that is used by the infected person is used to the healthy person, then it can also cause the we can say HIV. Or if the blood of the infected person is donate to the, or we can say given to the healthy person, then it can also leads to the HIV. Next you have prenatal transmissions, means HIV can be transmitted from an infected mother to her child during the pregnancy or childbirth or the breastfeeding also. Got it? Next question for you: what is the common symptoms of the syphilis? Common symptoms of syphilis, you have option painful urination, then after canker at the site of infection, genital warts and vaginal discharge. So common symptom of syphilis, basically the canker at the site of infection. What is canker? This is basically we can say a infection of any body part in which the we can say syphilis is going, a patient is infected, or we can say at the site of infection. We have like painless, or we can say rounded shore, that is typically appear at the site where the bacteria, that is Treponema pallidum. So this question is very important, as we had done with the questions like what is the causative agent of the we can say HIV, as well as we had just discussed the causative agent of your gonorrhea. So same in this way they can ask like what is the causative agent of syphilis. So you have to be remember, or just you have to clear all the concept. Like in this slide they can ask multiple questions from your side. So you just have to clear each and every topic that I am going to discuss now. So primarily site of syphilis, that is usually the by the swelling of the nearby lymph node, as well as they may canker may unmounted, as well as painless can also be can occur internally or in unconscious areas also. Next question for you: how can pharmacists contribute to the prevention of the STD? How can the pharmacist contribute to the prevention of the STD, that is sexual transmitted disease? By providing the condom and the lubricant, okay. Next option, by administering the antibiotic for the treatment, okay. By performing the diagnostic test for the STDs, okay. Now the last option, like educating the public about the safer sex practice and the regular testing, okay. So no doubt, as a pharmacist we can say provide the condom as well as lubricant also, but they cannot affected, like condom can prevent from the STD, but lubricant cannot be prevented. As well as the administration of antibiotic, like this is not our duty to administer the antibiotic, it's the duty of the nursing officer. As well as the performing of diagnostic test, that is not our duty, that is the duty of paramedical. But being a pharmacist, we are having the duty to provide the educations, to promote the peoples about the sex educations, about the we can say consequences of the disease, about like how you can be prevented by these disease. So just we can educate the public about the safer sex practice, as well as the regular testing, we can say counseling we can do patient. Next you have pharmacists can contribute to the prevention of the sexual transmitted disease by educating the public about the safer sex practice and the importance of the regular testing. Got it? So this is our primary duty. And like we are the pharmacists, we have the assembly with the healthcare professionals, and we are just providing the information and counseling for the STD prevention strategy, including the like correct use of the condom, reducing the number of sexual partner, communication with the partner about the sexual health. So these are the we can say duties of a pharmacist. These are the we can say work that a pharmacist can contribute for the society. Next, you have like what is the common complications of untreated chlamydia infection in women. So chlamydia infection in women, if it is not going to be treated on time, so what is the consequences? So option you have genital warts, pelvic inflammatory disease, that is PID, then canker at the site of infection, that is the symptoms of the we can say syphilis also. And next you have the vaginal discharge. So if chlamydia is going to be untreated, so it is going to be cause the pelvic inflammation disease. So pelvic girdle, we can say just basically is going to be inflamed, or we can say there is inflammation in the pelvic region. So we have two type of girdle. One is your pectoral girdle that include your claviceps and scapula, as well as you have the pelvic girdle that contain three bone, that is ilium, ischium or pubis. And ilium, ischium and pubis both are joined, like three bone can form a one bone, and this three bone can form one bone, and they can, and our pelvic, that is our pectoral girdle is attached to the humerus bone. So you have to be clear, like there is a pelvic means like pelvic girdle is also there, girdle is also there. So if you dance any single name, then in the same way as I am correlating, both have to be clear your own doubts in the same way. Got it? So a common complications of untreated chlamydia infections like that women have from the pelvic infectious disease, PID. So chlamydia, that is a bacterial sexual transmitted infection that is caused by the Chlamydia trachomatis that we had covered previously. Student, we had done with the social pharmacy for your upcoming Telangana Pharmacist examination. As you know, your exam like is going to be within this month. After few days, you have examination. So at the we can say you are at the end of your examination days. So in those days, you just have to try to cover more and more topic. Just watch all the model paper that is available on the YouTube. Just try to like watch on the 2x speed if you are having like a shortage of the time, and try to like we can say attempt all other question also, like you have the pharmacist book, typical MCQ book at your level, then try to attempt the question more and more. Got it? Hydrate your body by drinking the water, eat healthy, no need to eat unnecessary things. Got it? So next we have the pharmaceutical chemistry. So first question you have, like you just have to identify the drug name. You identify like drug that we have used in this. So question first, that is propranolol, nifedipine, amlodipine and phenoldiprine. So the typical diagrammatic representation is showing that one pyridine ring is there and one benzene ring is there. Both are attached, and the pyridine ring contain two methyl group and two acetic acid group, and the nitro group is at the phenyl position. So nitro group is there. So here is only one. Just I am just saying like a we can say to remember these. So nitro group is there, and simply you have the nifedipine. Got it? So propranolol, that is your non-selective beta blocker, nifedipine calcium channel blocker, or we can say calcium channel blocker first generation. It is basically used, that is also from the same category as we have the nifedipine. So these are the typical representation, as there is a difference between the amlodipine and phenoldiprine. Like nifedipine contain the nitro group, whereas at the same position contain the chlorine, and the same is amlodipine is also contain the chlorine. Phenoldiprine contain two chlorine on the benzene, or we can say phenyl ring, whereas amlodipine has having the one. Both having the acid group, all are having the same group. Sorry, these are the acetic acid group, but this is your, we can say, ethoxy group is there. Ethoxy methyl group is there. And very important. This is very important. Propranolol. So propanol contain the methoxy ring and having the alcohol at the second position, as well as they are having the ammonia group at the we can say they are having the propane ring. They are having the propane ring, three-membered ring, 1, 2, 3, and tertiary carbon at the end that contain the methyl ethyl amino group. Got it? So next you have like which of the following is the ester derivative local anesthetic? Ester derivative local anesthetic. So local anesthetic that are basically applied on the we can say area, like they are just, if there is any cut there, then they are applied here. They are just anesthetize a particular area, whereas general anesthesia are going to be anesthetize even like whole limb, whole leg, whole abdomen. And the question they are asking is ester derivative. So there are two basic classification of local anesthetic. One is your amide derivative and second is your ester derivative. Got it? So ester derivative, just a simple trick that you have to follow. In ester derivative you are able to see single I, but in amine derivative you are able to see 2I alphabet in their drug name. So lignocaine contain 1, 1, 2. Okay, it is amide. Then bupivacaine, that is also contain the 1 and 2. This is also amide. Dibucaine, that is also containing the 2 amino group. So it is also the amide derivative. Only the tetracaine among these four options containing the 1 I group, or we can say 1 I alphabet in their drug name. So it is the ester drug group. Got it? So same you have the ester drug, that is local anesthetic, like cocaine, procaine, benzocaine and tetracaine, whereas amide contain lignocaine, bupivacaine, dibucaine, prilocaine, ropivacaine. These are your amide drug class. So after that you have next question. In a titration experiment, what is the solution of the unknown concentration? The solution of unknown concentration, or we can say whose concentration we have to find, is known as the solution or titration excipient, or we can say component of a titration solution that is we don't know about the concentration, is known as analyte. So we can say unknown concentration of compound. So the analyte in a titration is the solution whose concentration is unknown, and analyte we are just basically taken in the conical flask. So conical flask we are just taking the analyte, or we can say whose concentration we have to determine or has to be determined by the titration. Whereas in the burette we are taking the titrant or analyte is also known as the titrand. So you are able to see titrand means D means down. So down the things like analyte, that is also always in the down position, like we are going to take the analyte on the conical flask. So before titration it is having the blue color, but at the end point, or we can say end point is those point in which the indicator is showing the color change. At that point we have to stop the titration and we just have to calculate the concentration and at that point come. Next question for you. Salicylate is option U, iambic acid, moric acid, phenolic, oxyphenbutazone derivative. So salicylate, as the name indicates, salicylate means like two salicylic acid is grouped. So it is very obvious that this is a disalicylic. So salicylate is an medication that is belong to the salicylate and as a non-steroidal anti-inflammatory drug, that is NSAIDs. So salicylic acid is a dimeric of the salicylic acid, having the formula C14H10O5 as well as the molecular mass is 258.229 gram per mole. This is the structure of the salicylate, having the we can say mixing of the two salicylic acid. Salicylic acid is nothing. Benzene ring contain the we can say carboxylic acid group as well as the hydroxy group. That is your salicylic acid. Next question for you. Which reagent is used in the limit test of lead? So basically we have the limit test of iron, chloride, sulfate, arsenic, heavy metal. So option you have acetic acid. Okay, we are not going to use as much. Next, you have the diathiazone, phenol red. Maybe we can use at the end of the lead test, or we have the 𝘂𝙀𝘋𝐿𝐼𝐴 acid. So in the limit test of lead, we are just using the diathiazone, that is principally having the violet color, but at the end it is going into the red. We can say itself it is having the green color. The complex that is formed is going to be violet in color, or resulting solution is going to be in the red color. We can say sometimes we can use the phenol red also at the very later stage, or we can say at the end of the lead limit test, just to clarify. But you just don't have to be confused. Phenol red not so much used in the regular limit test of chloride. Minute quantity may be used, we can say, for the accuracy purpose. So there is explanation of the limit test of lead, that it is based on lead and diaphenyl thiacarbazone. Diaphenyl carbazone is the chemical name of diathiazone. Like this is the chemical composition of diathiazone. It is nothing. It is your diaphenyl thiacarbazone. In an alkyl solution, it's lead to the formation of a red color, or we can say lead diathiazone. So lead, that is basically represented by Pb, react with the diathiazone having the chemical composition diaphenyl thiacarbazone. In the alkali medium, it is going to form a complex, that is lead diathiazone, and the solution is going to perform the red color. And diathiazone itself is having the green color, or maybe lead diathiazone, firstly it is having the violet color, but the resultant solution is having the red. Next question for you, like the ring present in diazoxide. So you have the four options. One is your benzothiazine, pyrimidine, indole, imidazole. So as like I am just solving this question, like I have no idea about the diazoxide. I am very blank about this question. Just try to, we can say, solve this question. Dia means do. You know very well, aza is used for the nitrogen, as oxa is used for the oxygen, and thia is used for the sulfur. So indole, that is totally different. Imidazole. So here is the two option. Benzothiazine. Diazine is there. Either is here is azole. So as a human being, I just clarify that dia means like there is a two nitrogen in the structure of the diazoxide. So same in this, like it is represented by the benzothiazone. Got it? So this is the typical diagrammatic representation of the chemical structure of diathiazine. As I told you, it is having the benzothiazine ring containing the one chlorine group, as well as the one sulfoxide group is also there, or we can say dioxide group, that is include we can say having the bonding with the sulfur atom, not H3 sulfuric group. So next you have again the question from the limit test, like the turbidity that is produced in the limit test of chloride is due to. So the turbidity that is produced in the limit test of chloride, that is due to, you have the option, that is AgCl, BaCl2, AgNO3, and your 𝘂𝙀𝙎𝙀. So AgCl, that is the silver chloride. So silver chloride that is going to produce the opalescence. So limit test of chloride, that is based on the reaction between the chloride ion, that is in the soluble form, and nitric oxide, silver nitrate, that is AgNO3, and dilute nitric acid, that is used to we can say for a acidic medium to make the solution pH acidic, and there is a formation of opalescence, or we can say turbidity of the silver chloride. Then we have to compare the test sample with the standard. If a test sample is going to be more turbid than the standard sample, then it is going to fail the limit test. If test is having the less turbidity and standard is having the more turbidity, so it is going to pass the limit test. Got it? So chemical representation, that is showing the chloride ion is react with the AgNO3 in presence of dilute nitric acid. There is a formation of AgCl precipitate, or we can say opalescence, cloudiness, turbidity is produced by your silver chloride. So next you have to find out the given structure. Find out the given structure. So you are able to see that there is a six-membered ring having two heteroatom, like one nitrogen atom is there, one nitrogen atom is there, and at one position there is a phenyl as well as ethyl group is also. So this is the structure of your phenobarbitone. So phenobarbitone, that is basically the barbiturates having the one phenyl group, one ethyl group, that is phenobarbitone. Hexobarbitol means phenyl group is replaced by your hexane one in ring. Then barbitol, that is containing the two diethyl group, and you have the cyclobarbitol that contain the cyclohexane as well as one ethyl group is also there. Got it? Clear everyone? So this is done with the chemistry part, and next the sir will discuss with you about the cognosy part. So please be patient with the next class also, and watch the complete sessions, revise each and every model paper. We had uploaded many questions, many we can say model paper you are able to see on the same YouTube channel that you are watching this now. Please share with your junior, senior, batchmate, friend also, and don't forget that success is your birthright. You had taken the birth in the form of a human being, means you are taken the success with you. So no need to panic about the examination, but you have to do the hard work. You have to do the revision. Revision, repeated revision is necessary. Got it?
Okay, so let us solve these questions. First question on the cognosy. Yes, coriander, fennel and cardamom are the examples of. So they becomes which class, or they comes under which classification? Either they become emetics or expectorants or tussives, antitussives or combinatives. Okay, if you know the answer, just comment down under the comment box. Yes, they all are comes under the combinatives. Yes, the combinative is a substance which helps to relieve the flatulence, okay, and abdominal pain by expelling the gas. That's the reason these are used as a spices in most of the protein food, okay. That's the reason they are comes under the classification of combinative. Examples are like coriander, fennel, cardamom, ginger, clove, asafoetida and cinnamon. So these are all the examples. What is the function of carbonative? They relieve the flatulence or the abdominal pain by expelling the gas out from the stomach or the intestine. Okay, these are the examples. That is coriander, fennel, ginger, clove, asafoetida and cinnamon. Very good. Let's see the next question. So match the following drugs with their chemical constraints. Yes. For such type of questions, you need to know minimum of 2 right options. Then only you will pick the, you can easily pick the right answer. Okay. Yes. So we know very well. So what is the classification of the senna, or what is the, what type of chemical content it was, or what type of secondary metabolite it was? Senna is a glycoside. Okay. Senna is a glycoside, and naxomica is a strychnine is an alkaloid. Okay. And acacia is a, what is that? Acacia is a protein, or this one. Yes. So that if you know the two answers, so let us go for the, okay, cross checking of the options. So senna is like I said, one means Q. Okay, either this or this or this. So and the naxomica means, which means again the naxomica is a alkaloid. So option 2, 2 R, which means either this one or this one. So that either this, either this. So we need to eliminate this option. So you need to pick the right answer from these two options. Okay, either this one, either this one. Okay, comment down your answer, dear aspirants. Okay, comment down your answer. Let me check the right answer. Yes, the option C means, one means Q, which means senna is a glycoside, and 2 means R, that is alkaloid, but whereas 3 means S, the acacia is a carbohydrate, but whereas gelatin is a protein. So that's the right answer. Next question. Yes, these are the different drugs with their examples: alkaloids, glycosides, and the lipids and volatile oils, tannins, resins and resin combinations, carbohydrates, vitamins, and other drugs. Just to remember the examples, they are very important because this is the chemical classification accordingly. Okay, next one. Substitution of genuine crude drug with a substandard one is called as. There are different types of conditions of adulteration are there. Inferiority, deterioration, admixture, sophistication. Okay, and yes, substitution. There are several types are there, but according to the statement, which one of the following is called substitution of genuine crude drug with substandard one is called as. Yes, inferiority, less quality drug, substandard or less quality drug. These are the different types of conditions of adulteration. Substitution, complete article was substituted with another one. Sophistication, which means an intentional or deliberate type of adulteration. Inferiority, less quality or substandard variety is used to substitute the drug. Deterioration, okay, impairment of quality of a drug, whereas spoil is due to the microbial attack, or admixture means addition of one article to the another article due to the carelessness collection. These are all the conditions of adulteration. We know very well adulteration is nothing but mixing or the substitution of original crude drug with similar looking substances. Okay, that's it. Which one of the following examples illustrate the use of an artificially manufactured substance to adulterate the beeswax? Okay, so which means what is the adulterant for the beeswax? Simple question. Basswood cut to resemble the nutmegs, and compressed chicory used as a coffee, and paraffin wax colored yellow, and yes, artificial invert sugar used as a honey. Okay, so yes, what is the artificial substance used to substitute the beeswax? Undoubtedly, the liquid paraffin or paraffin wax is used to substitute the original beeswax. Yes, it comes under the classification or it comes under the type of adulteration using artificially manufactured substances where the original drug is substituted with artificially manufactured substances. This is an compressed chicory and this is a coffee seeds. That's a one type of example, and another example is the paraffin wax is colored yellow and substitute for the beeswax. And another example for this type of adulteration is invert sugar. Artificial invert sugar is used in the form of honey. Okay. Yes. Next question. The alkaloid does not have heterocyclic ring with nitrogen but derived from the amino acid is called as. Okay. Either it is a protoalkaloid or true alkaloid or pseudo or none of the above. But according to the definition, definitely the nitrogen should be in the heterocyclic ring. If it is not there, so the answer should be yes, protoalkaloid. Okay, protoalkaloid. Yes, my dear aspirants. So these are the three types: true alkaloid, protoalkaloid, pseudoalkaloid. Okay, yes. True alkaloid means nitrogen in the heterocyclic ring. Proto means yes, they do have a nitrogen as well as the heterocyclic ring, but the nitrogen is not in the heterocyclic ring. But pseudo means they doesn't contain the heterocyclic ring, but they contain the aliphatic chain. Okay. Yes. So that's next. �〖�〖 test is to use to identify the either for anthraquinone glycoside, saponin glycoside, beta glycoside, and cardiac glycoside. �〖𝘖 test is to identify the which of the following? Comment down your answer. Yes, undoubtedly �〖𝘖 is for the cardiac glycoside. It is for the cardiac glycoside and especially to identify the sugar, that is deoxyribonucleic sugar. To identify the deoxyribonucleic sugar, dear aspirants. Okay. Yes. Next. The Clun's test is for the identification of option A, barbaloin, isobarbaloin, alanosides and alloazine, which means the Clun's test is for the allo, but especially it is due to the presence of isobarbaloin. You can see this Cupron is also known as Cupral-Owen test or Clun's test. Okay, Clun's isobarbaloin test. In this, okay, cuprasulfate plus sodium chloride plus alcohol will give you the wine red color with the allo. Okay, and yes, wine red color for the Curaçao allo, and faint color rapidly changing to the yellow, that is Cape yellow, and Socotrine allow, that is no color is produced, and Zanzibar allow is no color is produced, which means this Clun's test or Clun's test is mainly to confirm the isobarbaloin status. Okay. Yes. And hydrolyzable tannins on hydrolysis by acid yields. Hydrolyzable tannins on hydrolysis by acid yields. A. Benzoic acid, B. Gallic acid, C. Sodium bicarbonate, and D. Stearic acid. So, what is the right answer? Hydrolyzable tannins on hydrolysis by acid yields gallic acid. Yes. So, as the name indicates, these tannins are hydrolyzed by the hydrolyzable tannins. So, hydrolyzed by the acids or enzymes, and they quickly gives the products of hydrolysis of gallic acid as well as 𝘿𝙎𝙎 acid. Gallic acid as well as 𝘿𝙎𝙎 acid. Okay. Yes. So, some of the example for the hydrolyzable tannins are nut gall and 𝘿𝙎𝙎 tannin from oak bark and myrobalans from the pomegranate bark, dear aspirants. Okay. Yes, and also further on dry distillation, the gallic acid is further converted into pyrogolol. Pyrogolol. Yes, dear aspirants, this is for the model paper series 3 or model paper super model paper 3. For more such content, do subscribe and share to your friends. Don't forget to subscribe and keep on learning. Have a happy learning. Thank you.